The Policy Research Unit for Cancer Awareness, Screening and Early Diagnosis is one of the 20 policy research units commissioned by NIHR. As the name implies, Policy Research Unit, our aim is to produce high-quality research that can be used by policymakers in their efforts to achieve early diagnosis of cancer. We have 13 academic co-investigators. We have a range of projects using different research methods, and we are based at 5 English universities, which are Oxford, Leicester, Surrey, Cambridge, and University College London. Today we're at the University of Salford in Manchester, and we are getting together to showcase and tell each other about all our projects and all our studies. There will be 35 of us here today in person and another 5 or 6 colleagues online. We find these events are very useful for understanding what everybody is doing, supporting them with comments, and also understanding what other collaborations may be built on the work that is being done already. Achieving early diagnosis of cancer is a very complex aim and very complex problem. Therefore, it requires contributions from a range of scientific disciplines. So today we have representation from health economics to medical statistics, and from mixed methods and qualitative research methods to natural disease modeling.
So the research we lead on at the University of Leicester is all about monitoring trends in early diagnosis markers over calendar time, then link that to their cancer survival. We use anonymous NHS cancer data from a range of cancer sites. For instance, markers of early cancer diagnosis might be catching cancer at an earlier stage when it's less spread and therefore more treatable. And we try to link that to improvements in cancer survival. It's really important to use this NHS data that's made available anonymously for us to use, because it's really key data that we can use to understand the inequalities that exist right now and try to remove them in the future.
My research is in cancer screening. Screening is when we offer a test to people who don't have yet symptoms of cancer. And the intention is to identify cancer early on so that we can treat it and prevent death from the cancer and improve the quality of life of the person. We look specifically to see who to offer the test, when to offer, and which test to use. That is, we're looking more into a personalized way of screening.
As part of the research work that we're doing, we're investigating how to diagnose cancer more quickly. We do our work by using large data sets, so electronic health records from GP surgeries, to understand which patients are at high risk of cancer, which patients need investigated with which kind of tests. We like to understand which symptoms in combinations with which test results give us the highest risk of cancer, so we can understand when a patient comes to see their GP, which tests should be done and which patients should be referred. We're particularly interested in how to integrate new technologies into the cancer pathway, so specifically multi-cancer testing, to see how that would make a patient's journey quicker from turning up to see their GP with symptoms to being diagnosed with cancer.
Our programme of work is all about trying to understand how people are behaving. So what are they doing, what aren't they doing? But also we have a whole strand of work which is about reducing inequality. So we know people from certain socio-demographic groups are less likely to take part in screening, are less likely to seek help for their symptoms. So our work is not just about understanding those barriers in everyone, but trying to really drill down for those people that perhaps are more disadvantaged, making sure they get the right help as soon as they need it. So far we've held focus groups with different members of the public. We've also set up a board which is made up entirely and chaired by members of the public who have helped set up a strategy so that that can see us through for the next 5 years.
I've been involved from the very beginning in helping the PPI coordinator to set up the groups for each of the different work streams. PPI is patient and public involvement. And it's an opportunity for the PPI members to actually give comments on the work and look at it from a patient's perspective. I am a person with lived cancer experience. I was diagnosed at a very late stage I had very non-specific symptoms and had been to my GP several times, and then suddenly I was an emergency admission and I was diagnosed with stage 4 cancer and given 4 to 12 months to live. I felt that there were red flags that should have been picked up throughout my journey, and they weren't. So the purpose of us as patients and the public is to really keep the projects and the work streams on track and to make sure that the patient perspective is being considered at all points.
What's been really good about being here today is see the whole group develop since when we first started the Policy Research Unit. Lots of individuals are progressing through their careers and lots of new collaborations are forming between the members of each team and between teams. So it's been really nice to see capacity developing in this area.
It's really crucial, today's event, for patients, because we really get to talk about all of the different research projects from all of the different research areas to make sure that we're all on the same page and we're driving forward improvements that are really genuinely going to have a benefit for NHS patients diagnosed with cancer.
It's really important, particularly for a unit that is distributed in 5 universities, to every now and then get together, because that way we'll form bonds and stronger connections and networking of our ideas and our research. Because we're going to be doing bigger, better and faster research that will contribute to better policy making, which will benefit patients and the NHS.